skin biopsy is a key diagnostic investigation where the rash is not diagnosable on clinical history and examination alone. The skin biopsy gives further information of microscopic details of cell types, the ability to test that tissue with further advanced techniques such as using antibodies to determine the cell types, and also allows more depth. So structures that are deeper in the skin to be seen that are not visualized by simply looking and examining a patient in front of you visually. Skin biopsy is therefore needed for more complex and unusual rashes that are not responding in the usual way to treatments, and an important category of skin biopsies are performed for skin cancers. This performs two roles. One is actually treating and removing the skin cancer, and the second is diagnosing that skin cancer and making sure that the skin cancer has been completely removed. The vast majority of rashes, however, do not need a skin biopsy if they can be diagnosed easily by a dermatologist during your consultation. Clinical pathological correlation is the process whereby we take the results from the biopsy, the interpretation from the pathologist, looking down the microscope at all those microscopic details, and match them to the clinical patient in front of us based on the history and the symptoms they're experiencing and the rash and the distribution of their rash. Each gives useful information, and combined together that can lead to a good diagnosis for certain skin conditions that cannot be diagnosed just by clinical consultation alone. The skin biopsy does not give us information about the distribution of the rash, how widespread it is in the patient, and the way it looks, each individual lesion, clinically when we're looking and inspecting the patient. What it does, however, give is further microscopic details of cells and structures within the skin that cannot be visualized by clinical inspection alone. And because we're cutting through the skin, it allows us to also see microscopic details of deeper structures, as well as removing certain structures from the skin. So that is why an interpretation and conversation between the dermatologist and the dermatopathologist is very important for complex skin rashes in arriving at the diagnosis. The vast majority of skin diagnoses can be made during the first dermatology visit and consultation. Even within a few seconds of seeing the distribution of the rash, I can usually make that confident diagnosis. In the minority of patients and rashes that are more unusual, this may require further investigation such as a biopsy, which can take 10 to 14 days, or allowing patience and time for the full rash to develop so it can be better and more easily and confidently diagnosed.